Hi, and welcome back to Psychology 2. Now we're going to just pick up where we left off last week. This is Methods of Therapy Part 2. Now we're going to pick up at the social skills training. Then we're going to move into the cognitive therapies, group therapies, and biological therapies. Okay, so let's just get right into it. Now we did consider social skills training, and it's sort of a self-employed or self-monitoring. It's a testing method that allows you to monitor yourself. You can receive coaching, and there's modeling and role-playing and behavioral rehearsals and feedback. Now, often it's used to help formerly hospitalized patients maintain jobs and apartments in the community. Now, the group we're going to jump into is the cognitive therapies. Now, don't forget, cognitive and thinking are kind of the same. So these will be theories that use our thinking, or the thinking that's gone bad on us, to correct it. Cognitive therapies focus on changing the beliefs, attitudes, and automatic types of thinking that create and compound clients' problems. Repeated thinking can heighten insight into current cognitions. Our appraisals of unfortunate events can heighten our discomfort and impairs our ability to cope. Cognitive therapy aims to directly change maladaptive thoughts in an effort to reduce those negative feelings and solve problems. We're going to look at two important theorists in the cognitive therapy field. The first is Aaron Beck's cognitive therapy. Correcting cognitive errors is a big part of Beck's work. Therapists help the client change beliefs that are not supported by evidence. Clients need to become personal scientists and challenge beliefs that are not supported by the evidence. Beck noted a number of client errors. Cognitive errors contribute to the client's miseries as follows. Seeing only what you refocus on, what you're only refocusing on, essentially paying attention only to those things that support your fear and dismay. That can create great negative effect on your thinking. Secondly, clients will often overgeneralize. And this is taking one or two examples of some negative comments about you and accepting them as being everybody thinks. Well, no, two people thought, but that's not everybody. But that is one of the cognitive errors. Another might be that clients magnify or blow out of proportion. In other words, another word could be that one catastrophizes negative events, building a mountain out of a molehill in some cases. Another error is clients will engage in absolutist thinking. There's a person, here a person is seeing things as black and white, right or wrong. There is no middle ground. Now, a second theorist looked at what was known as, and this is by Albert Ellis, rational emotive behavior therapy, overcoming the musts and the shoulds. Again, developed by Albert Ellis, rational emotive behavior therapy, or REBT, focuses on beliefs about events as well as the events. Many people harbor irrational beliefs. For example, the irrational belief that we must have the love and approval of people who are important to us, or the irrational belief that we must prove ourselves to be thoroughly competent, adequate, and achieving. Ellis used the ABC model to help clients be able to see that their irrational beliefs are supported, how they're supported, and how to take action. And that's really important. How to take action to make those corrections and replace these errors, if you will, into more supported behaviors. The methods are directive and they're active. This is to say that the therapist is an active participant and a guide for the client. Ellis suggested that we need less misery, less blaming, and more action. So if we want, we can look towards this hybrid therapy of cognitive and behavioral. Many theorists consider cognitive therapy to be a collection of techniques that are a part of the behavior therapy. Beck refers to this approach as cognitive behavioral. Now referred to as cognitive behavior therapy, or CBT, an integration of the two approaches. And there's a variety of ways to engage this. One is with what's known as group therapies. And these are not for everybody or for all circumstances. There are strengths and there are weaknesses for group therapy. Advantages for group therapy is that they're economical. One therapist, several clients. Group therapies provide more information and life experience for clients to draw on because many heads give a broader view. So you get all that variety, and it helps sometimes to be very open about that. Now with the group, there are many in the group that can show support. Affiliating with people with similar problems, that's when you get together with people with similar problems, it can be very reassuring. Group members provide hope for each other. Many clients practice social skills in a relatively non-threatening atmosphere. The disadvantages of group therapy, well, you may have thought this before, is that group therapy is not for everyone. Clients may not want to disclose their problems to a group. Group therapy needs to be confidential. Another form of this therapy is what's known as couple therapy, and this therapy is intended to enhance the couple's relationship by improving your communication skills and helping them manage conflict. It can help correct power imbalances. It can also show ways of dealing with depression and anger. And of course, ways to solve problems. Typical approach for couple therapy is cognitive behavioral. Now related, but still different, is family therapy, and family therapy is a form of group therapy. Family interactions is studied and modified to enhance the growth of the individual family members and the family unit as a whole. The focus on individuals with low self-esteem to increase tolerance. It also aims to increase communication and encourage growth and autonomy. Well, does psychotherapy work? Well, back in 1952, Hans Eisnick published a review of psychotherapy research and determined that the rate of improvement among people in psychotherapy was no greater than the rate of spontaneous remission, or no difference as if they just left things and let them pass on their own, and that doesn't sound very useful. It was through meta-analysis, or statistical averaging is now used to show that psychotherapy is at least moderately effective. Researchers Smith and Glass found that psychoanalytic and client-centered therapies are most effective with well-educated, verbal, strongly motivated clients. 70 to 75% of those who obtained treatment were better than those who received no treatment at all. Gestalt therapy wasn't as effective at about 60%. It's not enough to ask which type of therapy is most effective. We must also ask which type is most effective for a particular problem or a particular patient. Does therapy work because of specific factors from the treatment, or is it due to the non-specific factors such as formation of the client-therapist relationship? Cognitive behavior therapy has been used to help anorexia, bulimic individuals, also used to treat anxiety disorders, social skills deficits, and problems in self-control. A combination of CBT and drug therapy has helped those with schizophrenia. Now next, it's important to consider psychotherapy and race and ethnicity. The issues concerning effectiveness of psychotherapy across cultures. People from ethnic minorities are less likely to seek therapy. Canadian immigrants come from cultures where therapy is labeled with a stigma or they are unaware that therapy can even be very helpful. Often there's a lack of information about the availability of services. Often there exists a distrust of professionals, particularly white professionals, and for women, male professionals. Language barriers can also be a barrier in getting support, as for many people there can be reluctance to open up about personal matters. Negative experiences with professional authority figures can always be an interference for immigrants. Clinicians need to be sensitive to culture. They need to develop a more multicultural competence. We'll use Asian Canadians as an example. There is a tendency to stigmatize people with psychological disorders. The Asian tradition is to practice restraint in public, so they prefer to receive concrete advice. Our Indigenous Canadians have been denied full access to key institutions in Western culture. Many psychological disorders experienced by our Indigenous population involve disruption of their traditional culture caused by European colonization. A loss of cultural identity and social disorganization have set stage for problems such as alcoholism, substance abuse, and depression. Black Canadians, about 2.5% of Canadians identify themselves as being black. In addition to addressing the psychological problems of Black Canadian clients, therapists need to help them cope with the effects of prejudice and discrimination. As a therapist, awareness of two cultural variations of individual versus collectivism. Measures like the following may help bridge the gap between psychotherapists and Indigenous Canadians, Canadian immigrants, and other Canadian visible minorities. And we'll start with number 1. Interact in language requested by the client. 2. Use methods that are consistent with the client's values and levels of acculturalization. 3. Develop therapy methods incorporating the client's cultural values. And it's not always easy, but in a more diverse population, this is what we need to do. So our last therapy group that we're going to look at is biological therapies. Biological therapies apply what is known of people's biological structures and processes to ameliorate their psychological disorder. So as you might imagine, the first thing that comes up when you look at biological is drug therapy. And we'll start with drug therapy. Anti-anxiety drugs may fall into the category of benzodiazepine. They depress activity of the central nervous system. This, in turn, decreases sympathetic activity and the feelings of nervousness and tension. Side effects can include the most common side effect, which is sedation. When use is stopped, clients may experience anxiety rebound or the reoccurrence of anxiety. It can induce a physical dependence, which is why getting regular blood tests done to verify the therapeutic levels is really important. You get only the value out of the medication when it's in its therapeutic levels. Antipsychotic drugs. Antipsychotic drugs reduce agitation, delusions, and hallucinations. Phenothiazines, they act by blocking dopamine receptors in the brain. Antidepressants, well, they're used to help clients with eating disorders, panic attacks, obsessive-compulsive disorders, and social phobias. They may stem from problems in the regulation of the adrenaline and serotonin. Antidepressants work by increasing levels of neurotransmitters. Serotonin reuptake inhibitors like Prozac block the reuptake of serotonin. Usually takes weeks to build up to a therapeutic level. The side effects, and there can be many, but many are temporary, include nausea, agitation, and weight gain. Lithium, as was mentioned earlier, lithium is used to flatten out cycles of manic behavior and depression. It affects the functioning of neurotransmitters. Side effects can include hand tremors, memory impairment, excessive thirst, and urination. Does drug therapy work? Well, drug therapy has helped many people with severe psychological disorders. Antipsychotic drugs largely account for the reduced need for the use of restraints or hospitalization visits for patients. They have allowed hundreds of thousands of former mental hospital residents lead largely normal lives in the community. Comparisons of psychotherapy and drug therapy in the treatment of depression suggest that cognitive therapy is as effective as antidepressants, and that's very encouraging. The combination of psychotherapy and drug therapy has been shown to be very effective in treating depression, panic disorder, and bulimia. No chemical can show a person how to change an idea or solve an interpersonal problem. Now, there is some other lighter therapies, and I'm playing with a word there. One is known as light therapy. And it's been hypothesized that part of the cause of SAD, or seasonal affective disorder, may be linked to the amount of melatonin one produces during prolonged winter nights. Common treatment is to sit in front of a large natural light source. Electroconvulsive therapy. Well, it's used mainly for people with major depression who do not respond to antidepressants. The procedure is this. Electrodes are attached to the temple, and electric current strong enough to produce a convulsion is induced. The patients are given a sedative so that they are asleep during the treatment. The patient typically obtains one ECT, or electric shock, treatment 3 times a week for up to 10 sessions. And for those extreme cases, it seems to have demonstrated some pretty significant and positive results. Now, another related therapy is called transcranial magnetic stimulation. It's a modern approach that places an electromagnetic coil generating magnetic fields on the scalp. The magnetic field stimulates affected neurons in the brain and is used in a treatment for depressive disorder, obsessive compulsive disorder, and schizophrenia. It presents a few side effects, which makes this method a promising new therapy because it doesn't seem to have a lot of side effects. Now, there is a more extreme therapy for extreme cases, and it's known as psychosurgery. It's not a very common approach, and it's an example of one. It's not one that's used a lot anymore. It was in the 50s, the 40s and the 50s, and it's called prefrontal lobotomy. This is where a surgeon would use a pick-like instrument to sever the nerve pathways that link the prefrontal lobes of the brain to the thalamus. It's pretty drastic, and it was. It intended to sever the thought from emotion. Now, Egas Moniz brought the procedure to the U.S. in the 1930s. There are some side effects, as you might expect. Hyperactivity, distractibility, impaired learning ability, overeating, apathy, withdrawal, epileptic-type seizures, reduced creativity, even death. The method has been discontinued in Canada. Deep brain stimulation is when electrodes are implanted into the brain that then deliver electrical pulses that stimulate the brain in very specific selected regions. Relatively new procedure. It began in about 1987. More research is needed to determine the proper frequency of the treatment and what areas of the brain ought to be targeted for the best results. Now, what I hope you can get out of therapies is that there is a wide range of therapies. And one of the key points mentioned earlier in the video was it's important that we don't just buy into a specific therapy, but that we look to what therapies will work for what conditions and what therapies are better for which patients. All right, there we go. Couple of things. We are now done. I have enjoyed this semester. I hope you have as well. And I hope you can enjoy what is upcoming for you in the next semester or at the end of your academic career. So everything is gone and done. So good luck, everybody. And we'll see you in another semester, I hope. Bye now.